Hey guys, this is Shubham, and today the topic of discussion is antiarrhythmics. So, before talking about the antiarrhythmic, which sounds like against the arrhythmia, but first of all, we should know about the arrhythmia. What is arrhythmia? Arrhythmia means the abnormal rhythms of our heart, or you can say, in other words, that these are the abnormal cardiac rhythms. So, that is the arrhythmia. Now, for the pumping function of our heart, for example, this is our heart, very basic diagram. If this is our heart, so for the pumping ability of our heart, there is the conduction system in our heart going on regularly, due to which our heart able to pump the blood. For example, our left ventricle contracts and pumps the blood through the aorta into the body tissues, right? So we need some kind of conduction system, some kind of electrical impulses, you can say, which initiate the ability of the pumping as far as heart is concerned, right? So the pumping ability of the heart is determined with the help of the electrical impulses, or you can say the conduction system, which is running in our heart, right? So we should know the components of the conduction system which are running in our heart, right? So what are the main components of the conduction system, right? So conduction system mainly consists of 5 elements. If we talk about the conduction system of our heart and how the electrical impulses are flowing into our heart and helping our heart to pump the blood, right? So let's look over the conduction system. So if we talk about the conduction system, what are the parts, what are the elements, and after knowing them, we will know about the drugs, because first of all we should know about the arrhythmia, we should know about the proper conduction system which is running in our heart. Okay, so conduction system mainly consists of 5 elements, as I already told you. So these elements are first of all we have the sinoatrial node, SA node, or more popularly we also call it as the pacemaker for our heart, right? Because it is the one which is responsible for initiating the electrical impulses inside our heart, right? So as far as location location is concerned, here is the sinoatrial node, right, which we also call as the SA node in short, right? So first of all we have the SA node then we have the AV node, right? And AV node, what is it doing? It is helping the electrical impulses which are coming from the SA node to flow through the AV node and going into the ventricles, which means it is the passage between the atrium and the ventricles for the electrical impulses, right? So this is the passage between the atrium and the ventricles for the electrical impulses. So the SA node is continuously generating the electrical impulses physiologically, I'm talking about, not pathologically. Okay, we will talk about that later, but right now, like in us, physiologically I'm talking about that how the SA node is firing. SA node is usually firing at the rate of 60 beats per minute. Okay, then the impulses, electrical impulses, goes to through the AV node. So here should be our AV node, for example here, right? Now the AV node will pass these electrical impulses from the atria into the ventricles, right? Now from the ventricles look, after the AV node, what we have? We have the bundle of His. Okay, we have the bundle of His. Then we have the bundle of branches, bundle branches. Okay, and at last we have the Purkinje fiber system. This is the Purkinje fiber. Purkinje fibers. And now if you talk about the flow of the electrical impulses, so as I said, the flow will be like this: SA node, AV node, bundle of His, bundle branches, and then eventually the Purkinje fibers, right? So this is the flow of the conduction system inside our heart, right? Now the thing is that is actually happening physiologically, like in us, like in you, right? But if somehow in any case SA node is failing to produce electrical impulses at the rate of 60 beats per minute for an example, right? So what could happen? At that case, what could happen? So for example, SA node is not firing properly, okay? So electrical impulses are going, but in less number, right? For example, first of all, it was 60 beats per minute. Now it's about 50 or 40, right? In that case, to meet the needs of our cardiac myocytes for the pumping of the blood through the aorta to our body tissues, in that case, our AV node and the bundle of His have some capability. The AV node and the bundle of His have some capability to produce some kind of electrical impulses by themselves, and this kind of property we call it as automaticity, okay? Because they are producing it by self. Auto means self. Because they are producing it by self, so we also call this property as automaticity, okay? So what is automaticity? In the case when the SA node is failing to fire the electrical impulses, in that case AV node and bundle of His have some capability to produce the electrical impulses by themselves. In that situation, we call that condition as automaticity. Fine. So this is the case where we can come across with the automaticity, okay? And this is actually the compensatory reaction of our body towards the failing of the heart. However, eventually it can't continue for longer time. In that case, the heart failure can occur, right? Or the heart attack can occur. So that was about the automaticity concept, and that was about the conduction system, how the electrical impulses are flowing inside our heart, right? Now let's move on to some graphs, that how the graphs can show their properties as far as SA node is concerned, and the ventricular muscle fibers. So we have to compare the graphs between the SA node and the ventricular muscle fibers, okay? Or you can say cardiac myocytes, the cardiac muscles of our heart. So let's compare and contrast the graphs between the SA node and AV node, and compare the phases, what phases are having in the SA node or AV node, and what phases we are having in the ventricular muscle fibers, or you can say the cardiac myocytes, right? Or ventricular muscle fibers. So let's look over there and compare and contrast these kind of graphs between the SA node and the ventricular muscle fibers. Fine. So let me drop this portion. So SA node, as I've already told you, that they are the one which are also called as the pacemaker of our heart, because they are the one which is responsible for initiating the electrical impulses in our heart, right? So for example, here is the SA node, and here we have the ventricular muscle fiber, or you can say the cardiac myocytes, okay? Cardiac myocytes. Now let's compare the graphs between them. For an example, this is the x-axis, this is the y-axis, this is the x-axis, okay? And let's suppose that this is the minus 60 millivolt over here, this is the minus 40 millivolt, okay, electrical current, and over here, for example, the plus 10 millivolt, okay? Let's suppose these values over here. Now, actually SA node are having three phases. The first phase they are having the phase 0, okay? Now what happens in phase 0 actually? In phase 0 what happens? The sodium ions comes inside. So look, for example, if this is the graph, okay, it will go like this. Now why is it going like this? It is approaching the threshold potential over here. So this is the resting membrane potential, which is the minus 60 millivolt, and this is the minus 40 millivolt. This is the threshold potential of our sinoatrial node. Don't forget that, okay? So it is approaching the threshold potential for getting the action potential, right? Because as there is the basic rule of the action potential, as there will be the depolarization, right? our action potential will start. As far as the resting membrane potential will approach the threshold potential, the depolarization occurs. Okay, then after that repolarization occurs. This is the basic rule of our action potential, right, for the happening of the action potential. So same thing is happening over here with the sodium ions influx. For example, here is the cell membrane. If we suppose here is the cell membrane, the sodium ions influx will occur, and sodium ion influx will cause this graph will move upward towards the threshold potential from the resting membrane potential. Okay, so this phase we call it as phase phase 4. This phase we call it as phase 4. Okay, then as it will reach up to the threshold potential, okay, the calcium channels, the L-type calcium channels will begin to open, and the calcium ions influx will occur. Okay, as it will reach up to the threshold potential, the calcium channels open, L-type calcium channels open actually, and the calcium influx occurs. Okay, the calcium rushes inside the cell membrane. Now what will happen? What will happen is it will go up, okay, like this, and this phase, this particular phase, we call it as which phase? This is the phase which we call it as phase 0. Okay, so this phase is phase 0. Okay, now what happens, as it will peak up at plus 10 millivolt, for example, right? It means the membrane is depolarizing at that time. Okay, at that time potassium channel begins to open. Okay, the voltage gated potassium channel begins to open, and potassium ions start to goes out from the cell membrane. Now what will happen? The L-type calcium channels will start to close, and the potassium channel will start to open, and potassium efflux start very fastly. In that situation, the graph begins to come down, right? It will begin to come down like this, and this particular phase we call it as phase 3. Okay, so in phase 1 what happens? So let me summarize over here what is happening. That in phase 1, okay, in phase 1 what is happening? In phase 2, in phase 4 first of all, in phase 0, and in phase 3. So what is happening in all these 3 phases? So in phase 4, the sodium ions were coming inside, right? The sodium ions comes inside the cell membrane. Okay, then in phase 0, the calcium ions comes inside the cell membrane, and in phase 3, potassium ions escapes out from the cell membrane. Okay, so these are the events which are happening inside the SA node, right? Now if we compare the SA node graph with the cardiac myocytes, so let me draw for you the cardiac myocyte graph, and let's look over there what is happening over there, and then we will compare. Remember, now you must be surprised that there are phase 4, 0, 3, but where are the phase 1 and 2? Phase 1 and 2 are not present in the sinoatrial node. Okay, as far as cardiac myocytes are concerned, or ventricular fibers are concerned, phase 4, 0, 3, 1 and 2, all the phases are present, which means phase 1 and 2 are not present in the SA node, but the phase 1 and 2 are present in the cardiac myocytes, okay, or ventricular fibers. So let's look over the graph, how the things are happening, how the events are happening inside the cardiac myocytes. So this is the graph, this is the y-axis over here, this is the x-axis over here. Okay, now let's suppose here is the minus 90 millivolt. Okay, remember here was the minus 60 millivolt. Here it is more negative, so it's the minus 90 millivolt, and let's suppose there is the plus 10 millivolt, right? Now look, likewise over here we have the phase 4. So first of all we have the phase 4, then we have the phase 0, likewise in the SA node. So here is the phase 4, but the things are little changed this time. In phase 4 of the SA node, sodium ions were coming inside, but for the phase 4 of the cardiac myocyte, potassium ions goes out with the help of the potassium leaky channels. Okay, we call them as leaky channels of potassium ions. So for example, here is the cell membrane. From this, the potassium channels escapes out with the help of the leaky channels, due to which phase 4 comes into place. Okay, now after that, as the potassium ions were leaking out, that's okay, but after that what happens, the sodium ions start to come inside. The sodium ions start to come inside, due to which the depolarization occurs over here. Okay, and we call this phase as phase 0. Okay, phase 0. Now what happens, sodium ions are coming inside regularly, right? Phase 0 occurs with the help of this. Now this graph will come slightly down, because still the potassium channels are going outside. Still the potassium ions are going outside with the help of potassium channels, right? Now with that, calcium channels, voltage gated calcium channels start to open, right? And calcium ions rushes in. Now the calcium ions are also rushes in, and the potassium ions are still going out. Due to that, equilibrium phase comes, and we call this phase as plateau phase, right? As this events happening over there, calcium ions are coming inside regularly, positive ions are coming inside regularly, and positive ions in the form of potassium ions, they are escaping out regularly through the cell membrane, and we can say this phase as the equilibrium phase. So in medical literature, we call it as the plateau phase. Okay, now what happens, the calcium channels, and this phase where the potassium ions were leaking out after the phase 0, this phase we call it as phase 1. This plateau phase we call it as the phase 2. Fine. After this, what happens? After this, the calcium channels, these were the voltage gated calcium channels, they will start to close. As they will start to close, what will happen? The calcium ions will not be able to come inside now. As far as potassium channels are concerned, they are still open. So which means potassium ions are still going out, but the calcium ions entry is blocked, right? So what will happen? The potassium ions are still going out, so the membrane repolarizes, okay, and this phase we call it as finally phase 3. So as you can see, here is the phase 1 and phase 2, okay, plateau formation, plateau phase, but in the SA node we don't have the phase 1 and phase 2. Okay, that is the basic difference if you compare the graphs between the SA node and the cardiac myocytes. Okay, so remember that phase 1 and phase 2 are not present in the SA node, but they are present in the cardiac myocytes. Okay, so that is the basic difference between the graphs of the SA node and the cardiac myocytes, because this is very important, because whatever drugs we are going to discuss now, okay, they are working on different phases of SA node, and they're working on different phases of the cardiac myocytes. So better if you note down these graphs in your notebook, right? Now after this, let's move on to the real story of the antiarrhythmic, that is the drugs, which we deal with them, what classes we have, and what particular class works on which kind of phase, okay, which is very important. So now we have the concept about the graphs, we have concept about the phases of SA node and the cardiac myocytes more importantly, right? Now we can discuss about the antiarrhythmic drugs. So now let's go into it and talk about the antiarrhythmic drugs. First of all, we'll talk about the classification. So what is the classification of the antiarrhythmics? Now let's talk about the classification of the antiarrhythmics. So what drugs we have? Classification. Okay, fine. We have the 4 classes in the antiarrhythmics: class 1 agent, class 2 agent, class 3 agent, and the class 4 agent. Okay, so the class 1, okay, class 2, let's make it like this, class 3, and class 4. So basically we have the 4 kinds of antiarrhythmic agents, okay, different classes. And let me tell you very superficially what classes are working on which kind of channels. For an example, if we talk about the class 1, they are working on the sodium channels. Actually they are blocking the sodium channels, so they are the sodium channel blocker. Okay, so they are the sodium channel blocker, which means they are gonna block the sodium channels. And remember, they are working on the ventricular muscle fiber, which is the cardiac myocyte. There we had the phase 4, 0, 1, 2 and 3. So the phase 0, okay, more basically the phase 0 were making over there with the help of the influx of the sodium ions. So that channels class 1 agent are going to block and repress and suppress the phase 0, okay, in the ventricular muscle fiber. We will talk about that in detail. Let's come over to the class 2. They are the beta blockers, which means they're going to act on the beta 1 receptors, okay, they're going to act on the beta 1 receptors and are reducing the effect of the catecholamines on the heart, which means they're going to reduce the heart rate as well as contractility of the myocytes, right, of what? Heart. Let's talk about the class 3 agent. Class 3 agents are the potassium channel blockers, actually. Potassium channel blockers. And finally, the class 4 agents are the calcium channel blockers. Calcium channel blockers, right? So these are the superficial things where the class 1, class 2, class 3 and class 4 agents are working. Now let's move into it. What drugs do we have? Okay, in the class 1 agent, as far as class 1 agent is concerned, we have the class 1A, okay, we have the class 1B as well as we have the class 1C. So class 1 agents are divided into 3 more classes, or you can say class 1 agent is divided into 3 more subclasses, which are the class 1A, class 1B and class 1C, and they are having the different kinds of drugs over there, okay. More specifically, they are gonna act on, more specifically I will talk about then class 1A and class 1C. They are basically working on the sodium channels. However, class 1B also works on the potassium channels, and what they are doing, they are making more refractory period, okay, of the graph of the ventricular muscle fiber, of course, of the cardiac myocytes. So now let's look over the class 1A agent drugs. Class 1A agent drug, you can remember them with the help of the mnemonic, which I have made the like double quarter pizza, or you can make it like this, DQP, double quarter pizza, right? Now what are these? Diisopyramid, Q for quinidine, okay, and P for procanamide. So these are the class 1A agents, okay, these are the class 1A agents. We have the class 1B agents also. So here I am writing the class 1B agents. So these will be the class 1B agents, okay. Class 1B agents, you can remember them with the help of mnemonic, like for an example landmines or landmarks, okay. They are just for the remembering purpose, is for the sake of the remembering, okay. So L is the lidocaine, which you have already studied about it in the local anesthetics also, right? This is the very widely used local anesthetic nowadays, right? Worldwide. And M for maxilatin, okay. These are the class 1B agents. Now we have the class 1C agents also. So class 1C agents I'm writing over here, class 1C. Class 1C agent, what we have? You can remember them with the help of this mnemonic which I am using over here, that is the fingerprint, okay, or footprints. You can make your mnemonic. So this is mine. From the F, that is the fleekenite, okay, and from P, that is the propafenone, okay. So these are the class 1 agents. Class 1A agents are these ones, class 1B and the class 1C. Now let's look over the class 2 agents. The beta blockers, as you have already studied about this in the adrenergic receptors topic, right? For example, the adrenergic blockers or the anti-adrenergics, the beta blockers, right? What drugs we have? We have many. For example, esmolol, right? Esmolol, atenolol, metoprolol, right? Esmolol, atenolol, metoprolol, propranolol, right? So all the olol are the beta blockers, right? They are the class 2 agents in the antiarrhythmics, right? In the class 3 agents, we have the potassium channel blocker, right? And what we have, say in the mnemonic, you can use over here also. I made like SAD, okay? So SAD, let's look over the drugs. What drugs do we have? S for the sotalol, okay? Amiodarone is very famous drug in the class 3 agents of the antiarrhythmics. I will talk about it, that why is it so. Drondarone, okay, and dofetilide, okay. About the class 4 agent calcium channel blockers, verapamil, okay, VD or valid, you can make yours. V for verapamil, okay, and D for diltiazem, right? These are the calcium channel blockers. So this is the proper classification of the antiarrhythmics, right? So the class, we have the class 1A agents, we have the class 1A, class 1B, class 1C, and the class 2, class 3, and the class 4 agents, right? So this is the classification of the antiarrhythmics, okay? Better that you make the notes of this classification, as it is very important, right? And further, we need these drugs to treat the arrhythmias, right? For example, what drug do we have in this class, what drug do we have in this class, for example, right? And what side effects do we have, right? And about comparing the side effects, which drug is more better than any other drug, right? And which could be more better for the patient, right? So after the classification, after discussing the classification, let's move on to each and every drug, right? Let's move on to each and every class. So let me rub this classification, okay? And now we will move on to the each and every class, okay? Let's not rub this, and let's discuss like this only. For example, if we will talk about the class 1A agents, okay? Class 1A agents, mostly they are used for the supraventricular tachycardia or the ventricular arrhythmias, as well as you can use these drugs for the atrial flutter and the atrial fibrillation also, right? These drugs works on the class 1A agent. They works on the phase 0 in the ventricular muscle fibers. Remember that class 1 agents, we are using it in the they are working on the ventricular muscle fiber, which is the cardiac myocytes, okay? Ventricular muscle fibers. Let me write over here also, so that you don't confuse, that the class 1A agents, we are using them for the ventricular muscle fibers. Okay, ventricular muscle fibers. Now, so the class 1A agents, they are working on the phase 0 of the ventricular muscle fibers. As I told you that these are the sodium channel blockers, we have already seen over there in the graph in the cardiac myocytes or the ventricular muscle fibers that the phase 0 was making over there with the help of the sodium ions influx, with the help of sodium channels. So if they will block the sodium channels, there will be no phase 0 in the ventricular muscle fibers. That's how they are working over there. The sodium channel blockers, which we also call as class 1 agents and class 1A more basically. If we talk about the class 1B agents, okay, if we talk about the class 1B agents, then they are working on the sodium channels as well as they are working on some potassium channels also. Okay, that's why they are working on phase 3 also, right? So what they are doing, they are extending the refractory phase of the action potential in the ventricular muscle fiber, right? So they are working also on the phase 3, because phase 3 we have already seen that phase 3 was forming with the help of the potassium ions efflux. Potassium ions were escaping out with the help of the potassium channels over there, right? Let's move on to the class 1C agent. About the class 1C agent, the flecainide and the propafenone, they are also used for the ventricular arrhythmias as well as class 1B agents also used for the ventricular arrhythmia or the supraventricular tachycardia also, right? And they are also working on the phase 0 of ventricular muscle fibers. So that's why they are the sodium channel blockers, right? Adverse effects, if we talk about the adverse effects, in the class 1A agents, diisopyramide have some anticholinergic effects. For example, the dry eyes, dry mouth, right? Urinary retention. We are having the tachycardia, right? In that case, so they are having the anticholinergic effects for the diisopyramide. For the quinidine, we could have the side effects like blurred vision, nausea, dizziness, right? Tinnitus, for example, in the ears, right? So these kind of adverse effect can be considered under the quinidine, okay? And some anticholinergic effects are considered with the diisopyramide. Now, if we will talk about the class 2 agents, okay? Class 2 agents, okay, about the class 1B agent adverse effects, lidocaine can show some kind of CNS toxicity and the maxilitine can show some kind of nausea, vomiting symptoms, right? These are some adverse effects, as every drug has some adverse effects. So lidocaine is quite safe, but in some cases in higher doses they can show some CNS toxicity, right? About maxilitine, they can show some nausea, vomiting, dizziness, headache, these kind of symptoms as an adverse effect, right? Now, class 1C agents also, they can show some nausea, vomiting, dizziness, headache, these kind of symptoms, right? As they're very obvious in many kinds of drugs, in many kinds of classification, right? So these are about the adverse effects of the class 1 agents, class 1A, class 1B and the class 1C agents, right? Now let's move on to the class 2 agents, okay? So the class 2 agents, as I told you that they are the beta blockers. So what they are doing, class 2 agents, they are setting on the beta 1 receptors and they are blocking it. So they are reducing the effect of catecholamines, epinephrine or norepinephrine, which is coming from the adenomedulla actually, right? So they are reducing the effect of catecholamines on the beta 1 receptors and eventually on our heart, right? So what they are doing, they're reducing our heart rate. As the beta 1 receptor will be blocked, our heart rate will also be reduced and our contractility of the muscles, which is the cardiac myocytes contractility, right? It will also be reduced, right? Remember, the class 1 agents are working on the ventricular muscle fibers, but the class 2 agents, they are working on the SA and AV nodes, which means the class 2 agent beta blockers, they are working on the SA and AV node. So let me write for you over here that they are working on the SA and AV node, sinoatrial node and the atrioventricular node, right? Now, before moving on to the class 3, one more thing I would like to mention over here, I would like to add about the class 1 agents, and that thing is the class 1 agents, while using them, they should be carefully monitored also at the same time, because class 1 agents have some potassium ions, right? So what they can do, that they can initiate the arrhythmia themselves. In some kind of cases, it have been seen, the class 1 agents are making the arrhythmia. Okay, they're showing the effects of the arrhythmia themselves, right? Class 2 agents, we have already discussed about it, right? The esmolol is very important as far as beta blockers are concerned in the class 2 agents of antiarrhythmics, because esmolol can be given in emergency situations. Esmolol can be given in emergency situation through IV, right? And can save the patient in case of arrhythmia. So in the emergency condition, among beta blockers you have to choose, then go for the esmolol, right? As worldwide, esmolol has been given. They are using it in the emergency situations through intravenous injections, right? Moving on to the class 3 agents, potassium channel blockers. We have the sotalol, amiodarone, dronedarone, and dofetilide. Amiodarone is most widely used drug in the class 3 agents. Okay, so they are the potassium channel blockers. And if you talk about which phase is affecting the potassium channel blockers, so that will be the phase 3. And remember, they are working on the ventricular muscle fibers, not SA or AV node. So let me write it over here for you, that ventricular muscle fibers are mainly affected over here. Ventricular muscle fibers. So this is about the class 3. Now, amiodarone is most widely used drug. Why? Because they're having the longer half-life. Okay, and it has been seen that they are accumulating in tissues after discontinuation of the therapy also, right? So because they are having the longer half-life and they are having the side effects, it's quite higher as we compare with the dronedarone, right? Dronedarone have lesser side effects, but it's not much effective as amiodarone, right? So that's why amiodarone is more widely used. But amiodarone have some side effects also. For example, they are having the side effects as pulmonary fibrosis. They can have side effects as neuropathy, hepatotoxicity, some kind of thyroid dysfunctions also. For an example, the hypothyroidism or hyperthyroidism, right? Heat tolerance or cold intolerance. In that situations, these are the side effects for the amiodarone, right? So for the side effects purpose, if some persons are showing the side effects as I mentioned over here about the amiodarone, so the doctor can switch on to the dronedarone in that situation, right? However, amiodarone is most widely used drug in class 3 agents, right? About the sotalol, it can block the potassium channels also, as well as it can work on the beta receptors also, right? That is the main thing about the sotalol, which you have to note. Talking about the dofetilide is the most selective potassium channel blocker. Okay, so remember, dofetilide is most selective potassium channel blocker. However, they can initiate arrhythmia themselves. So this is kind of side effect or adverse effect you can remember about them. So they can arise the arrhythmia themselves as they are blocking the potassium channels. So in some situations, they are not able to block them properly. In that situation, they can initiate the arrhythmia themselves. Talking about the class 4 channel, that is the calcium channel blockers. About the calcium channel blockers, we have the two drugs. In case of antiarrhythmic, we can mention that verapamil and the diltiazem. Okay. Now verapamil and diltiazem, where they are working, they are mainly working in the SA and AV node. Okay. So the thing which you have to remember about the class 4 agents, that they are working on the SA and AV nodes, not on the ventricular muscle fibers. And which phase is affecting, right? Which phase is affecting? The phase number, mainly the calcium channel blockers. Calcium ions were causing the formation of phase 2. So they are affecting the phase 2 in the SA and AV node. But in the SA and AV node, if you talk about the SA and AV node, they don't have phase 2. So we have to go with the some kind of phase 0, you can say. In some cases, they can work on the ventricular muscle fibers also. In that situation, phase 2 can be affected, right? However, if we are talking about the SA and AV node, then in that situation, the phase 0 will be affected. So phase 0 will be affected in SA and AV node. However, they are very less working on the ventricular muscle fibers. So you don't need to remember about the phase 2 for the ventricular muscle fibers. So you have to remember about the phase 0 for the sinoatrial node and the atrioventricular node. So what you have to remember, that what class agents, okay, are working on which kind of fibers or which kind of sinoatrial node. That's why before discussing about this classification, before discussing and before going into the details of these kinds of drugs, I've drawn the graphs and compared them in front of you about the SA node and the cardiac myocytes or the ventricular muscle fibers, so that you can really know and compare the mechanism of action of these kind of agents of the antiarrhythmics, right? So I hope you enjoyed this video. Thanks for watching and stay tuned for more. Thank you.